So yes, the first week it's intermittent, and then after that, everything is proficient.
Okay.
So I have a few things that once everybody joins us,
Okay. I can
I'm gonna just
see what we have to do in the HESI, the regular.
perfect. Good. So hopefully that should work. One person said that they have an issue, so hopefully she has it figured out now.
Yeah, I can definitely get in. I just went into the first one. We're good.
Oh, good. Are you enjoying the classes so far, or do you want to be back on campus?
I'm really not happy with this.
Yeah, yeah.
I'm really unhappy with it, and we're not getting a fair shake here. I feel scared to. I feel scared about it, but I mean, I can. It's not a big deal to do the work, but I don't think that we're learning the right way. I think we need more hands-on, and that's why I purposely came to this school and didn't go to another school. But it would be like this anywhere. It's not the school's fault.
That's the problem. I think, all of the schools have this issue presently, and I'm hoping that, well, I know everybody's hoping that that will turn around and we can, because the problem is the hospitals are the ones that have to say, hey guys, we're welcoming all students back. That's part of the problem. Hello, Miss Amber, our IT queen.
She is.
We can't get in. Why can't they get in?
I went into the one you originally sent to get in.
Yeah, hang on. I think they probably went in the new one. And I was going to talk about that in a second. I put a link to it, but
because I couldn't get in with the new one. I could get in with the old one.
You couldn't get in with the new one. Okay.
I'll text Mimi and tell her to go in with the old one.
I wonder why. I want to test that out. The reason I did a new link is because the new link is through, rather than the web browser, the new link is through a desktop app, which allowed me to do the breakout channels. Whereas the old one, I couldn't seem to do breakouts. So hey, did you use the old link, Rhonda, to get in?
Yes, I did. I was trying to figure out how to add it to the calendar the way I just come straight through.
Yeah. I'm going to see if I can add it. I've in the meeting chat put the link in the meeting chat, and in a minute I want to see if we can get in there. The reason I did that is because when I tried to do the breakout channels through the web browser, it didn't give me the little side section to do that. When I did it as an app, it did, which is probably how you did it, Amber, right? You have an app.
Yeah.
Yeah. And I think that maybe that's why I redid a link for you guys. But we'll test that out in a few minutes, and once I've seen the presentations, and see if that works. So hopefully they'll be able to get in. Old link. Where did you find the old link, Evelyn?
From the email.
Okay.
The original emails I've been going in.
Let me just let them know.
Seems like we're gonna get a storm, huh? It's a coming.
Rhonda, how did you find the assignment? Not too bad?
How did I find the assignment?
Was it okay? Hey, Kaylin. Good. Hi, Kaylin. You have a shocked look on your face. You okay? Can you hear me? Nope. All right. She's disappeared. Okay. Just waiting on Elisa and hopefully Mimi. How did assignment, Kaylin? You can't hear me? Okay. All right. While we do that, let me just. All right. Where are the others?
Mimi said that it's her, and I don't know. Maybe they're both. I just sent her an email that we are in the old original one. I think she might be in the other one.
Okay, let me see if I can go to the other one and find them.
We don't see you.
Hello, ladies. Hey, guys. Are you in this one? Hello. Okay. Let me see.
Can anyone see me?
Yes.
Okay. I was just making sure because
Mimi's trying.
Okay. Yeah, they went to the other one. I should have waited to do that. Sorry, guys. Didn't mean to confuse you. Okay. Trying to think if there's anything I need to just mention. I'm going to wait till everybody gets in. And then we'll go. Have you all done your syllabus receipts?
Yes. Yes.
Good. You've all been able to get into the EAQs. You can get on the HESI stuff now. Okay. I don't know what the problem is. Are they saying what the issue is?
I haven't heard back from her again. But if I know,
I just emailed her. I just text her the link to this one.
Thank you. Yeah, because it's in the emails, and actually it's in the Canvas
yeah, that's how she
module
was
as well.
originally going in.
I tried to get in through the Canvas one, but it didn't
work?
let me. So I went back to that email you sent me Tuesday morning, and then that's how I kind of got back here.
Okay. So this new link, well, it did let them in because they ended up in the other class, so it does work. Okay. Let's see. Do we have to? I'm not sure what it.
Let me call her.
Okay.
Elisa, tell her to call her because I don't know how to. She's having a hard time.
Why don't we do this? Do me a favor. They're in the other one. Let's join them in the other one.
Okay, so how am I doing that?
Okay. So hang on, first of all. Let me tell them. Ooh, guys.
The one that was sent this morning at 8:38, that's how you want us to go in on that?
Stay in the new link.
She's already on her. The link that I just sent her, she was able to get in. We'll try to see it on her phone, but she's going through it through her computer so she can join us.
Elisa is?
Mimi.
Mimi is. Okay. All right, here's Mimi. Hi, Mimi, stay with us. All right. Does anybody have Elisa's information?
I don't.
Send it to her.
Yes,
Okay.
I'm about to send it to her.
Good.
Okay. So the reason I did a new link that I apologize. I should have left the old one up until we got back together. The reason I did a new link is I can't do channel breakouts with the web browser. I can only do channel breakouts with the app, whether it's on the phone or the actual laptop or whatever. So I was sort of playing with it. So I apologize. Don't mean to stress you out.
I just need my 88 points and not be late. You know what I mean?
You'll be fine. Don't worry. You're fine. I'm going to get you some GABA. You know, GABA is a neurotransmitter, right?
Yes, ma'am.
Okay. Do you know we use GABA? You can literally buy GABA over the counter. Seriously. I call it the natural Xanax. I tell my students, go get yourself some GABA.
Okay, I'm going to get it today.
It's wonderful. It's a natural thing. It can be very helpful. I deal a lot with patients that have menopause and all sorts of issues like that. And, they'll come to me and a primary care doc will have stuck them on an antidepressant and Xanax and something to sleep and this, that, and the other. And I'm like, oh my goodness, they need progesterone, melatonin, and some GABA.
Right.
Is what they really need, right? We need to replace those hormones, get them feeling good, get some GABA on board, and some 10 milligrams of compound slow release melatonin, and they'll be much better.
So GABO. Okay, I'm going to Walgreens.
GABA.
GABA. Yeah, I'm
GABA.
going to
I want to say about I think off the top of my head about 300 milligrams of GABA. It's not a cure-all, but what I'm saying is I have noticed that there's, I use a lot of supplements and things, patients, and I use combinations that work on the adrenals. Where are the adrenals, by the way? Any idea where the adrenal glands? Where are the adrenals? Anyone know?
On top of the kidneys?
Yes, they are. Good job. So they actually do. They sit just above the kidneys. And what do these adrenals do? They pump out cortisol, right? That's part of what they do. Our bodies go, oh my gosh, I'm being chased by a lion. And the adrenals are one of those things that help to pump out cortisol. We need our cortisol. We need it for life. But what happens in your situation, because if you've got a lot of stress and work and studying and trying to juggle all these different things, and oh my goodness, you're constantly on overdrive, and you can only do that for so long before your body goes, yeah, I've had enough of this. And that's when the adrenal burnout happens. That's when your adrenals take a nosedive. Hello, Elisa. It's so nice to see your face. And I know I probably pronounced your name wrong again, right?
We're good.
Tell me how you say
Elisa.
it properly. How do I?
She said Elisa.
Elisa. Okay, please help me with that. So I was just telling them about your adrenals, and this is relevant. You're going to get into this stuff later, but there's a thing called the HPA axis, the hypothalamus, the pituitary, and the adrenals. And what happens is your body goes into overdrive with stress. You're pumping out all this cortisol, and your body eventually goes, that's great. I can't pump out all this cortisol. Think of insulin resistance, right? With diabetes, it's the same thing. So my goal is to help downregulate all of that. So if I suggest to you, take a nice adrenal supplement that's got some things like ashwagandha, ginseng, a little bit of GABA, it's all good. It will help you in the long run. Seriously, it will help you from getting adrenal burnout. And that is a real thing. All right, so here we are. So first of all, I apologize. I was playing around with the links a little bit because I was just explaining what happens is with the web browser, I can't do breakout channels, but with the apps, I could. So from now on, we will use the new app, all right? The new link. The one that you two went to and already tested for me. Thank you, because I want us all to test that, because I want to see if those breakout channels work. So you've been my guinea pigs. Thank you so much. I appreciate your help.
So you want us to go to the one, not this one today, the other one.
In future, but before we do that, we will test it as a group because I want to see if those breakout channels work for you. That way, if you need to, you can just go to those breakout channels. All right. I've got one as team 1, one as team 2.
Yeah,
you can use them, but I want to make sure they work first before we do that. All right. So that's that. A couple of things I just want to take care of. Some of you had an issue with getting into the HESI cohort tile. Elisa, I think you did. Elisa, you had a problem with it, and you sent me some links. Are you able to get in them now or not?
Yeah. I've done.
They're all working for you. Good.
It doesn't say the class, but does that matter? It's just assignments that pop up. Oh, she's frozen.
She's frozen.
Do you want to build a snowman? Oh, there she goes.
I need some GABA.
You keep
all right.
That's why.
Remediation. You guys. remediation. You guys had a question for me about how I grade remediation. I spoke to Miss Minwar about this. Different professors have different opinions as to how it goes. Again, it's a guideline, and actually it does state in the remediation, it's the guidelines. Guidelines means there is some flexibility. Yes, we want to do things correct and properly, but it's not a mandate guideline. Therefore, from my perspective, if you do the work, I give you 100%, right? I want you to get 78%, because guess what? You have to pass in order to pass an exam, you need to get 78%, right, in your finals. So it's good to have that in your brain, sort of get that in your brain. I need to get 78%. I need to get 78% in my whatever I'm going to do, my quizzes, my exams, whatever, to pass my HESI and move on. But for the remediation, if you have done the work, I see your pre, I see your post, I'm going to give you the 100% for doing the work, okay? And that is how we used to do it. We did used to do it that way. For some of you that did funds, remember, Rhonda, didn't we do it that way? Yeah. So I did talk to Miss Minwar about that, and so that's how I would do it. So again, breathe, take that stress away, you're all good. What else did I want to say? Oh yeah, so 2 other things I want to just discuss with you. Quizzes. The quizzes are open book. The quizzes are open book. All right? Isn't that nice? The quizzes are open book. I don't know if you heard that. Exams are proctored. What that means for you is you will need to get your phone, show me what your room looks like, show me, put your phone by your computer or laptop so that I can see that you're not cheating. But your quizzes are open book. So I'm still going to do it synchronously, but I'm not going to be watching you. You're going to be doing it. I'll say, hey, it's 8 o'clock. Go get the quiz done. We'll meet back at 9:30, yada, yada. All right? But you're able to use your resources to help you with the quiz. Not bad, eh? Yeah? Oh, come on. Give me some enthusiasm.
Oh, we're enthused. We just were on mute.
I thought that was pretty nice. All right. What else? So I think those are the biggest pieces that I wanted to touch base on and let you know. All right. Without further ado, I'm sort of excited. Oh, and by the way, when you look at the module for this particular assignment, you will see, and I'm going to show it to you right now. Let me do this. Share my screen. In this particular module, in the clinical assignment, can you see right here where it says peer reviews? You click on that, and each of you are going to be reviewing somebody else. All right? How do you like that? So for those of you that have concerns, is that, how do you feel about that?
I like it. I like it a lot.
Oh, look, she's doing a British accent.
I'm crazy. Okay, I quit, y'all.
All right. So, so that gives a little bit of oomph to it, doesn't it? A little bit of oomph to what you guys are doing. And each week it's going to change. So you won't be reviewing the same person each week. All right. So this means you have to be very kind to each other, kind and caring. That's what we are, right? So without further ado, is somebody able to share their screen and show me the fantastic work that they did this morning? Who's going to be team leads on these?
I'll do mine.
All right.
Yeah.
All
Me.
right.
Oh, blind. Go ahead.
All right.
Oh, wow. For real? I'm done.
Yeah, we made
I'm
it all
done.
nice and pretty.
done.
All right, I'm muting you, Mimi. I'm muting you. You're muted.
All right, so we chose BB. It was me, Evelyn, and Rhonda, the future RNs in the class. So yeah. Our medical history. BB is a 79-year-old woman. She was brought to the emergency room complaining of shortness of breath and feeling hot and sweaty. 2 months ago, she was diagnosed with stage 4 cervical cancer. And today, her family found her lying in bed, shortness of breath, sweaty, and they called an ambulance. So the objective data that they showed us, her vitals, her blood pressure was 100/60, pulse is 96, respirations is 28, her temperature is 101.4, and her pulse ox is 88%. Obviously, she has stage 4 cancer, and then she complains of shortness of breath and sweating. So, yep. This is a book that Evelyn had that she sent me a picture. It just shows the squamous cell carcinoma in the cervix, so it shows a picture of that. And then just some risk factors of cervical cancer is frequent intercourse at a young age, multiple sexual partners, sexually transmitted infections like HPV, smoking, and then previous history of cervical dysplasia. And then at the top, it just shows different things to look for if you think you have cervical cancer, something like that. So the patient problems that she complained or that we found, there's crackles in bilateral bases in the lungs, labored respiration. So obviously they're abnormal and she's using an increased amount of effort to breathe. So she's in respiratory distress. This is our concept map that we started off with. So it's just Mrs. Beebe. And then she has an elevated temperature, elevated respirations, sweating, complaining of feeling hot, shortness of breath, elevated pulse, and then stage 4 cervical cancer. And so we put together elevated respirations and elevated shortness of breath, and that a nursing diagnosis is ineffective airway clearance. So some interventions that we had was to auscultate patients' breath sounds every 1 to 4 hours, monitor pulse ox levels, and then administer oxygen to a patient as ordered. Some expected outcomes is the patient's pulse ox is expected to rise to normal limits within the first 2 hours of admission. Throughout the shift, the doctor will be able to prescribe decreased levels of oxygen, and then nurse will continue to monitor for decreased crackles in lungs every 1 to 4 hours in their shift. So just checking the vitals every 1 to 4 hours as well. For the family and client planning, we put teach the family of a dying client in hospice with a death rattle that rarely clients are aware of the fluid that has accumulated and help them find evidence of comfort in the client's nonverbal behavior. And then teach the client and family to identify and avoid specific factors that exuberate ineffective airway clearance, like anything she's allergic to, smoking, and then exposure to secondhand smoke. And then the last 4 that we grouped together is elevated temperature, cancer, shortness of breath, and sweating. We put a risk for infection because just because her pulse was high, her temperature was high, and so we just thought that she had an infection or a risk for infection. And some interventions is to observe and report redness, warmth, discharge, and increased body temperature, encourage fluid intake, assess skin for color, moisture, texture, and turgor. And then I can't see what that one says, but that's our last one right there. It's kind of, the screen's in the way, so.
It's assess temperature or of a neutropenic client.
Perfect. Thank you, Evelyn. All right, so the expected outcomes is the nurse will administer acetaminophen as prescribed. The nurse will monitor temperature every 2 hours during their shift, and the patient will drink 3 liters of water throughout shift. And then the family and client planning there is to teach the family and client how to take temperature correctly and teach family and client how to use proper hand hygiene. And then we're done.
You freaking show off.
No, I have extreme OCD, like controlling. I have a lot of issues my group noticed, so I like to go above and beyond what I do. So
there's nothing wrong with that, and it's fun, right? Did you have fun doing it?
We learned a lot. We all participated. A+ to the group.
See, good job.
Mm-hmm.
I have a problem because I don't know how to do a slide. I don't know how to make it look like a slideshow. So hold on just a second. Y'all keep talking though. Yeah.
Well, you know what? The thing is, this is the learning piece of it. As you become more comfortable with doing these things, 3 or 4 weeks in, you'll be putting memes in there. You'll be putting all sorts of fun stuff in there. And I think it's a fun way to learn. And it's nice to show the other groups what you're doing, because what you focus on, another group might be focusing on something completely different. So I have a couple of questions for you. First of all, cervical cancer. This lady has stage 4 cervical cancer. What do we do to screen for cervical cancer?
I'm sorry,
you broke up.
You broke up. I don't know what you're asking.
Okay. Can you hear me now?
Yeah.
Yes.
Okay. What do we do? What is a screening tool for cervical cancer?
Pap smears.
Pap smear. Yeah.
Yes. When do we start the pap smears?
Sexually active or their early 20s.
21. Yeah. Absolutely. Or if they're sexually active before then, absolutely. Or if there's an issue, of course, then we do. Yes. And there's a couple of strains that are the big issues with the HPV, 16 and 18, I think. And there might be one more, but those are the 2 biggies that we always, I mean, there's about 44 different strains of HPV, by the way. So just because somebody has HPV, and they come and go, HPV can come and go. And so I try to tell my patients this because I don't want to freak them out. If they do have HPV, sometimes it just disappears. So I don't want them to become overly concerned. Yes, you want to check on all of those things. What can be given to prevent HPV?
There's a
Gardasil shot?
Yeah.
A vaccine?
Yeah.
Yes. Yes, exactly. So the other thing I want to just mention about this case is this little old lady, we're looking at infection. One of the things I noticed that I didn't see there on your interventions was potential antibiotics, and I'm just wondering why you chose not to do that. I'm thinking that was a reason you didn't, and I wonder, what?
Because a doctor would prescribe the antibiotics, not us. That's why I didn't. That's why it's not included, because that's a doctor thing.
Okay. Okay.
We would administer them if the doctor ordered it.
So you could, in the future, you could put that if you want, say antibiotics as prescribed by physician, something along those lines, if you wanted to, because yes, and just to let you know, SATs were low, blood pressure was also low. Now, my blood pressure runs like 90/50. But that's different because I've always been into fitness, right? But you know, a little old lady like that, that's pretty hypotensive as well. So, you know, that's an issue for someone like that. But I think you guys did a great job. It seems like you really learnt a lot and looked in the books and
The thing with
came
that
together
patient,
as a
though,
group.
is she really she doesn't want any help. So she should
Yeah.
just have been made measures to, you know, have oxygen, make her comfortable, and she should be they should give her an option of having hospice then in.
Yes.
Yeah.
Yeah. Palliative care and
Right.
hospice, you know. Mimi, you got your hand, if you got your hand up, is that what you're doing?
I mean, yeah, like, can y'all get off of our presentation? You know what I'm saying? Can we go before y'all keep going?
Yes.
I'm just
Absolutely, Mimi.
thank you. I appreciate it so much. Professor, is that all right with you?
Let's do it. Over to you.
All right, here we go. I'm gonna go ahead and take it, y'all, since they wanted to act a mess. You know what I'm saying? Let me just go ahead and help us out real quick. Oh boy. If I can get this slideshow going. How you do this? Run a slideshow. All right, so as you can see, we have decided to go with the end of life care. We automatically went to that for a few different reasons. So this slide is going to be presented by the real nurses of Concord. That would be Miss Mimi Fitz, Miss Elisa, and Miss Kaylin. Here we go. All right, so the case study, Miss BB. She's 79 years old, a 79-year-old woman, is brought to the emergency department by ambulance. BB is reporting shortness of breath and feeling hot and sweaty. She was diagnosed with stage 4 cervical cancer 2 months ago and decided not to have any treatment. Her husband died, which is very key, 1 year ago, and she has been living alone since that. In the last 2 months since her diagnosis, she has been cleaning out her house, donating things to charity, and giving her daughter family photo albums and jewelry. Her daughters have continued trying to get her to have chemotherapy, but Miss BB refuses. They would check on BB every day and said that she had been getting weaker in the past week. BB lying in bed, shortness of breath, and dysophrenic is called, there we go, and called an ambulance. So, like I said, in this case study, we want to hone in on the fact that she's 79 years old and that she is now a widow. Now, if we know anything about healthcare, we know that when somebody has been with their spouse a significant amount of time, once the spouse goes, then automatically their health, their give a darn, and everything else starts to decline and decrease, and they just want to give up. It's called failure to thrive. Therefore, Miss BB, at 79 years old, feels like she's lived her life. She's raised her children. Now her husband is gone, and she's ready to meet him on the other side. So that was about a year ago. So it's not any shock to her that she's in the stage of wanting to do what she needs to do, which is clean house, so to speak, which is what she's doing. We're going to move on to the next slide.
Good job.
The next slide is the patient's history. She has a history of hypertension, which is HTN. She has osteoarthritis, and then now she has stage 4 cervical cancer. Her social history is that she was married and widowed 1 year ago. She lives alone, and she has 2 adult daughters. Okay, can I go? No? Okay, there we go. Nope, there we go. Yep. So her chief complaint and underlying symptoms. Of course, she's has SOB. Of course, she's diaphoretic. She weighs only 100 pounds, 5'4", with a BMI of 17.1. Now, if you know anything about health, nutrition, and the nutritional guidelines, we know that a BMI of 17.1 is almost anorexic. So by her having that BMI of 17.1 and only weighing 100 pounds, she's already pretty much given up. Her current status and event is that her vital signs are as follows: BP 100/60, pulse is 96, respiration is 28, temperature is 101.4, and her SpO2 saturations are 88% on room air. We know that she has labored respirations, that she has bilateral base lung crackles. She desires to expire at her own residence. She refused chemotherapy, increased decline in the last 7 days. Statement says patient stated she doesn't want, and I spelled that wrong, doesn't want to die in the hospital as she has made life-altering preparations. The nursing interventions. We want to provide comfort measure for her. So this is what we're honing in on in our quote-unquote concept of this nursing intervention. We want to hone in on the fact that we just need to make her comfortable. We need to offer her religious services and visits. We need to discuss with her palliative care and hospice options. We want to provide the family with end-of-life resources. We want to request meds, i.e. pain and antibiotics for the O2, and then we also want to get him to agree to put her on some type of O2 elevation for ease of discomfort. With this being said, automatically we know that there's certain things as nurses we can do to make her comfortable, which is we can sit her in high Fowler's position, put a couple of pillows behind her head, we can elevate her feet, we can make sure she's repositioned or whatever. However, the thing with her is she wants to give up. And guess what? A part of the 9 patients' rights, that's her right. So she had the absolute right to refuse to go to chemo. And she has the right to want to fail to thrive. That's her right. So we're just going to make her comfortable. Evaluation. The patient repositioned, as I said, in high Fowler's or relocated to a quieter area in the ER. Pastoral care did come by and visit her. Her family, both of her daughters are at bedside. The patient family consult went successful with case management, and she has agreed to go home with hospice care. The doctor did order oxygen at 2 liters via nasal cannula, and he went ahead and ordered the morphine for comfort and respiratory distress. He didn't feel like at this point in time that the antibiotic was necessary. So like I said, he just ordered the morphine, which is going to make her comfortable, which is going to also say that any other things that she has going on, she's just going to be in a comfort measure. Are there any questions?
I don't have any questions.
Don't play with us. Anything else, Amber?
And hang on, didn't this come from somebody who was like, oh my gosh, I can't do this?
Well, you know, my team was 100. We did really well together. At first, I thought we was gonna have a problem, but you know, teamwork made the dream work. And by us being the best nurses at Concord, you know what I'm saying, we had to throw together a little something. Had to show up the little millennial over there. Thanks, little Blondie.
Oh my gosh.
Me and
Wow.
Amber don't need that, Professor. We good.
Both of you guys did an awesome job. I'm so impressed. Did you have fun doing it though? Did you enjoy it as a learning tool, you know, to sort of get you thinking and look at the patient as a whole? And absolutely, that's what this lady needed. She needed case management on board, somebody to advocate for her. That biggest piece really is where it needed to go. You know, the living will, the DNR, all of it. You both did great jobs because, like I just said, you had the same case, but you pulled out different things that were both incredibly appropriate. And it is a shame that we don't do clinicals because, you know, you something that you said made me think. One of the things in England that I was taught when and I was taught very like it was very military actually. You know, the matron would come on and your patients better all look fantastic or you were in trouble. When you gave report, you better make sure you had it all in your head. You stood at the end of the bed and you gave report. And that was the way you did it. Your sheet, you had to know it. You had to know your patient. But my point is, you mentioned about pillows and the high Fowler's position and using 2 pillows. Well, and I don't have anything to show you, but how we do it is more like an armchair. And you basically put a pillow at the top, one here and one here, and it creates like an armchair. And you have no idea how many times I've seen patients scrunched up looking uncomfortable, and I've walked up and I've gone, let me just adjust your pillows because it's driving me nuts. And like, you know, and because it's all about me really. And so I basically get their pillows and I do this and I put it in that position, and they immediately, they look so much more comfortable. And I ask, you know, does that feel better? Yes. I mean, it's amazing. And that small little thing, just adjusting their pillows in that type of position, you know, it's the little things that we can do. It doesn't have to be major interventions for those for those things to make a patient more comfortable, whatever the situation is, whether they're in the ER or whether they're in hospice or whether they're on a med surg floor or an ICU. It's all the same, right? So I thought that was a really interesting point that you brought that out. Has anybody ever done that with the 3 pillows, by the way? Has anybody ever tried that?
Yes, ma'am.
You have.
I worked as a nurse.
Excellent.
I mean, I've been a nurse for 14 years, but with my previous experience as a CNA or whatever, we actually, that was back in the day, like I'm 40 years old. So they really did teach that back in those CNA courses. I don't know what they're doing now a year, but back in those days, that was the first thing, was because they said nurses ain't got time to be running in and out of rooms. So make sure that you teach the CNAs how to position and reposition and do, you know, a better job, because it can start, that care starts with them CNAs. They think it starts with the nurses. No, it starts with the CNA.
Absolutely, it does. But, you know, I think that we as nurses, and as I say, I trained in a very old-fashioned, what is called a very old-fashioned way, but it was a fantastic training. 6 years on the job residency. That was the British system of training. Great training. I mean, literally day one, literally my first week, I was helping with a bone marrow biopsy from the sternum. I mean, you know, yeah, that doesn't happen right now. I mean, it just doesn't. But
you're building a snowman. Elisa, shut up.
I can't.
You're frozen.
I know. I've never seen that. Oh my Lord. I'm going to start praying over this. Well, I do anyway. Before I start my day, I pray over you all anyway.
Okay.
But I think I'm going to specifically pray for the technology, right? Anyway, so I was burbling, whatever. It doesn't matter.
I'm going to get the gavel.
Okay, frozen again. I think that gave you a bit of an idea of how the concept map can work along with helping guide you for a care plan, right? So this afternoon, you've got a few hours to sort of play with the second case in your groups, and you might want to, you know, add bits to it, whatever you've done, if you've started working on them, and just sort of have fun with it. And then let's see, maybe we can, what time would be, do you want to meet at 5? Does that give you plenty of time, or do you want to meet slightly earlier than that?
Well, look, here's the question. Let's just be honest. I know everybody's thinking it, so I'll just go ahead and be the class spokesman. If we finish,
I don't keep you till 7.
Okay, praise the Lord. Well, hallelujah. What time y'all want to meet?
Well, it's 2:00 now. Are we all ready to go? We have to just look at hours real quick.
Done.
Wow. I think it's my end.
No,
Mimi,
I'm not ready.
Okay.
Finish your question, Mimi.
Oh, so my question is, if we get back on site around 3-ish and we're finished by like 4-ish, are we going to be allowed to leave? And you said yes already. I heard you say we ain't got to stay until 7.
Right, you don't have to stay till 7. I would rather do it a little later. I would say 4.
Okay.
You know, I think 4 is reasonable, and we'll do from 4 till 5. Before you go, I do want to just talk a little bit about next week. So next week, the script is flipped a little bit, right? So Tuesday is your 12-hour day. Wednesday is 8 till 1. So yes, look at your schedules, because it's only this week that we do it this way round. So I just want to review the times. So normally on Tuesday, it's 7A to 7P. Okay. Thursday is 8 till 12. And it is all in that first section for you in your schedules. There is a schedule there. And also on the announcement page at the bottom of there, it states it. There are 3 Wednesdays, week 2, week 4, and week 6, that we go from 8 till 1. Okay. Now, yes, the expectation isn't that you are having to be recorded and online for 12 hours solid. Usually about 3 hours, because of course you're doing stuff in between that time as well. Okay. Tuesday of next week, which is going to be your 7 a to 7 p time, I want to go over a little bit what the quiz is going to look like. It's going to represent the work from this week. So basically the chapters that we went over on Tuesday. Okay, that's what the quiz is going to be based around. There will be some dosage calc in there, and on Tuesday we'll do a little bit of dosage calc as well. So I won't do it today, but I'll do a little bit then. And you can let me know if there are certain areas that you want to go over regarding. I know you did some in funds, and you did some, I'm sure, in farm. I know Miss White does a lot of dosage calc. So you know, so we can go over some of those milligrams per mils, or some of the simpler ones we'll do for next week. I'm not going to launch into the milligrams per kilograms per, you know, mics and all that stuff. We'll do that a few weeks in. So I just wanted you to be aware of that. So what I'll do from this point is let you finish off your next pieces, however you want to do it, whether it's a concept map or whether you've got a teaching tool. Bring those points out, make it look fantastic so that we all learn something and have some takeaway points at the end of it. Okay? Any questions? Oh, you know what? Before we go, can we just check this link? Let me check out the other link for you guys.
Amber, stop looking at me like game on. Cut it out. Stop it.
Let me see if this other link works. So let's go out of here. Go. I don't know how to do this. Do me a favor. Go out of this one and meet me in the other link. I want to see if it works. Can you all do that? Okay.
Are we there? Are we there?
Mimi, which one you on?
I don't know. I think it just combined the both of them, because I said I ain't got another open link.
Okay.